Today's subject is removable prosthodontics. A distal extension partial denture receives its support from terminal abutments, equally from abutments and the residual ridges, mostly from residual ridge or exclusively from residual ridge. Here the answer is mostly from residual ridge. Mandibular distal extension RPD extends up to full length of retromolar pad, anterior 1/3 length of retromolar pad, anterior 2/3 of retromolar pad, or none of the above. Here the answer is anterior 2/3 of the retromolar pad. Mandibular distal extension RPD which extends up to anterior 2/3 of the retromolar pad. Bilateral edgeless area present posterior to the remaining teeth can be classified as Kennedy's class 1, 2, 3 or 4. Here the question is about bilateral edgeless area which is present posterior to the remaining teeth. So here this is the situation. So this is class 1. And here unilateral edgeless area, that is class 2. Here the edgeless area bounded anteriorly and posteriorly by natural teeth, then it is class 3. And unilateral edgeless area is crossing the midline, that is class 4. Then Kennedy classification which is more suitable for an internal attachment is class 1, 2, 3 or 4. So the answer is class 3. So for class 3, there is a more suitable for an internal attachment. RPD is indicated in all except long edgeless span, multiple edgeless spaces, excessive loss of alveolar bone or distal abutment. So here answer is multiple edgeless spaces. The main advantage of RPD over FPD in replacing bilateral lost teeth. So what is the main advantage of RPD over FPD? That is cross-arch stabilization or aesthetics or less expensive or comfort to the patient. Here the answer is cross-arch stabilization. Purpose of treatment removable partial denture for convenience until a more definitive denture is rendered, to condition the soft tissues that have been abused by ill-fitting prosthesis, or aiding the patient in making transition to a complete denture, or to condition the patient to wear a removable restoration. Here the answer is to condition the soft tissues that have been abused by ill-fitting prosthesis. When designing RPD for a Kennedy class 2 arch, the clasp configuration usually employed is unilateral, tripod, bilateral or quadrilateral. Here for Kennedy class 2 arch, the clasp configuration is tripod. For class 1, it is the bilateral, and class 3 it is quadrilateral, and for class 2 it is tripod configuration. Functional impressions of class 1 partial edgeless arches may be made by Hindle method, fluid wax impression method, reline method, or all of the above. Here, the functional impressions of class 1 partial edgeless arches may be made by all the methods, that is Hindle method, fluid wax impression method, and reline method. So all of the above is the answer. Liver action that occurs in distal extension partial dentures is first order liver or second order or third or fourth order liver. Here the answer is first order liver. So it is the class 1 liver action is occurs in the distal extension partial dentures. Here the fulcrum is in between resistance and ephyta. This is the fulcrum and this is the resistance and this is the ephyta. So fulcrum is in between resistance and the ephyta. Okay. Advantage of U-shaped palatal strap is increased rigidity or support or stability or none of the above. So here it is the U-shaped palatal strap. It is the increased support. Advantage of wide palatal bar over narrow bar. What is the advantage? less discomfort or less bulk, or more tough or more tissue coverage or area of braces seat? Here the answer is less bulk. Lingual bar connector should be located at least how many millimeters below the gingival margin? 2, 4, 6 or 8? Here the answer is 4 millimeters. That is, lingual bar connector should be located at least 4 millimeters below the gingival margin. For long-span distal extension bases, where the rigidity is critical, the major connector of choice. Is it by palatal strap or anteroposterior palatal bar or closed horseshoe or horseshoe? Here the answer is closed horseshoe. Borders of major connectors adjacent to gingival crevices should be no closer to the crevices than 1 to 2 mm, 2 to 3 mm, 3 to 6 mm or 7 to 10 mm. Borders of major connectors adjacent to gingival crevices should be no closer to the crevices than 3 to 6 mm. Preferred maxillary major connector is? Is it single palatal strap or anterior posterior bar or horseshoe shaped major connector or complete palatal coverage? Here the answer is horseshoe shaped major connector. So least preferred maxillary major connector is horseshoe shaped major connector. What is no-shoe effect and what does it indicate? Broad coverage or physiologic basing or indirect retention or all of the above? Here the no-shoe effect indicates broad coverage. The minor connector leaves the major connector gradually or abruptly or covering large area or without any relief. Here the answer is abruptly. Passive retention in RPD is provided by direct retainers or undercuts or indirect retainers or guiding planes. Here the answer is guiding planes. So passive retention in RPD is provided by guiding planes. Distance between maxillary major connector and tooth tissue junction is 2 mm or 4 mm or 6 mm or 8 mm. Here the question is distance between maxillary major connector and tooth tissue junction. It is 6 mm. Size of the burr preparing lingual receipt for an RPD is 1 by 10th inch, 1 by 4th inch, 1 by 2 inch or 1 inch. Here the size of the burr preparing lingual receipt for RPD is 1/4 inch. The class 4 partial dentures should be made of. Is it gold or iridoplatinum or platinum or silver? Here the answer is gold. Terminal component of clasp end is shaped as long, stop, finger or arm. Here the terminal component of clasp end is shaped as arm. Any clasp assembly should encircle at least how much of the abutment tooth? 120 degree, 160 degree, 180 degree or 360 degree. Here the answer is 180 degree. Junction of mandibular minor connector with major connector is butt type of joint, acrylic forms the joint or ball and socket joint or there is no joint. Here the junction of mandibular minor connector with the major connector is butt type of joint. And that's all for today's lecture. And please do subscribe for more videos and see you on next video. Thank you.